All right. Well, I want you guys to all close your eyes for a minute. And I want you to imagine yourself in the 17th century, and you wake up in the morning with the worst sore throat you've ever had in your entire life. You go grab a glass of water sitting next to the bed, and you take a sip, and just the sip of the water makes you feel like you're suffocating. And so you're going, man, I feel like I'm having a hard time breathing. You guys can open your eyes now. And you go, I feel like I'm having a hard time breathing. And you tell your wife or you tell someone, go get me the best doctor in the area. I need some help right now. Something's seriously wrong. I can't breathe. Somebody help me out. So they go get the best doctor in the area. They bring in this doctor. He's the best doctor of that time period. He comes in with this little doctor bag, and he says, all right, we're going to help you. We're going to make you better, Adam. We're going to fix you. And so he lays you on the bed, and he takes a scalpel, and he puts a bucket underneath your arm, and he puts pretty precise cuts in different parts of your body, and he starts letting the blood run out of you. And he thinks that this is what's going to fix this. What am I talking about? What is this called? Bloodletting. Exactly. And he says, this is going to help you, and we've done it. This is what we've always done. This is going to work. Well, it doesn't work. So now you got a sore throat, and you're bleeding from your arms. So he goes, you know what? Let's bring in another doctor. This guy, he knows what to do. So he comes in, and he's got this little jar of Spanish flies. And he goes, you know what I'm going to do? I'm going to put these flies on your throat, and they're going to cause a blister. And that blister is going to pull out all of those toxins that are in your throat right now. So now you're bleeding, you got a sore throat, and you got blisters on your throat. And they go, you know what? This other doctor says, you know what? Let's give this guy an enema. I think that'll work. This sounds like the most unprofessional thing I've ever heard of in my entire life, right? And so they say, we're going to give this guy an enema. So now you got diarrhea, you're bleeding, you got blisters on your throat. What I'm describing to you guys is the events that led up to the death of our first president, George Washington. He was out riding his horse and marking trees that he wanted to get cut down in December, and he started developing a little bit, kind of shortness of breath, a little bit of a sore throat, went to bed, woke up at 8 o'clock in the morning with that sore throat. By 10 o'clock that night, he was dead. Now, looking at the history of medicine shows us some really interesting things. I love to study people. I love to study how medicine has progressed. But why do I find this story so interesting? And why do I want to start off with this story? I find this picture very intriguing. And I want you guys to look at this picture. And the initial doctor that showed up is not here. But if you look at this guy right here, as we zoom in on him, this is Dr. Elisha Dick. And Dr. Elisha Dick mentioned to them, he says, you know what? I have an idea. I think we should cut a hole in his throat, put a tube in there, and that allow him to start breathing. And these other doctors looked at him like he was off of his rocker. They'd never, what are you talking about? We're not going to cut a hole in his throat. If they would have done this, he probably would have lived. Now, granted, he was in his 70s, I believe, at the time when he passed away, but they drained not half, but a third of the blood supply from him. So now not only he can't breathe, his hemoglobin's probably low, now they're letting that blood run off of him. And the procedure they used to do is they would cut you, and they would let you bleed until you pass out. Once you pass out, they'd put a bandage on you, and they'd stop the bleeding. And then they would wait for that blood to kind of make new blood. And eventually they would think that the blood would sit stagnant, so you had to let it loose once in a while. So I find this thinking so interesting because even back to this time, people were scared to step outside of that group think. He was with these doctors. He had this idea. He had an idea that would have saved their life, but he didn't do it. And so thinking about critical care medicine, and the reason I start off this entire session that we're going to have, over the next 3 months, we're going to be talking about this, is because these people around you, look at the people in this room, this is a very, very particular breed of people. These are people that are not scared to step outside the line sometimes and think about strategic risks or things that they have to take. Sometimes, is it risky to cut somebody's throat and put a tube? Yeah, there's some risks with it. but do the benefits outweigh the risks? And that's what I want us to talk about. So I was thinking, this is a skill that's performed very often now, but then it was so foreign to them. So what skills are there now that we don't even know of that we're going to be doing in 10, 20 years from now? And why are people so scared to step outside that line sometimes? And thinking about it, I have to trace it back to thinking about the youngest we can be, in school, and they tell you, they want you to stand in a line. They don't want you to step outside the line. You raise your hand if you have any questions. They get all these things that they want you to do, and we build this thinking that we have to fit in with every single person. And you see groups of teenagers, and this groupthink is what happens when people all want to start thinking alike. So what I'm going to encourage you guys to do is to try to step outside the lines a little bit in this class. Try to think of things that maybe no one has ever thought of before. When we're talking about these, and the medication dosages and all that, yeah, that's important, but cognitively offload that stuff and start thinking critical. So this is something called the Ash experiment. And Dr. Ash said, everybody tends to think alike. And if everybody thinks alike, then nobody's really thinking, right? So we put this experiment, and what he would do is he called 10 people into a room, right? Well, he had briefed 9 of them before, and he said, I'm going to ask you which one of these 3 lines on the right look most like the line on the left. But I want all of you guys to say A. So obviously, looking at this, what line do you think is the most like the one on the left?
C.
See, it almost is identical, right? So he said, I want you guys to look at that, and you guys all say it's A, and we're going to see if that one person in your group says A too. Happened every single time. Yep, it's A. They would all say A. This groupthink is what's responsible for a very significant amount of the wars we see, and a lot of the things that we see that occur is because one person is scared to think separately. They're scared to think a little bit differently than everyone else. Now, how many of you guys have seen House? You guys ever watched the show House? This is by far the best example of critical thinking. Not one single person in that group will agree with the other person. He says it's a sore throat. Eric says it's lupus. He says it's sarcoidosis. He's saying that it's epiglottitis. Everybody's got a different kind of diagnosis, but you know what? They're not all going, yeah, what he said, that's fine. Whatever he said, that's fine. And so that's why this conference and this refresher, I like to call it a conference because refresher just sounds so boring. This conference is really getting us to get into that critical thinking and brainstorm. So it's not just going to be me standing up here talking the whole time. We're going to have you guys out of your seats. You guys are going to be doing some activities. We got some of the best speakers, most passionate about the topics, going to come in and talk to you guys, and I think we're going to have a lot of fun. So we're going to start off with how do we develop critical thinking. Now, when I was like 17 or 18 years old, I was taking vocal lessons because I was in a band. I played the drums, and they were like, one of us should learn how to sing. So I was like, all right, I'll learn how to sing. So I took some vocal lessons, and my instructor was like a 70-year-old lady, and I'm trying to show her Audio Slave and songs I want to learn, and she says, if you really want to hit those notes, you got to sing with your gut, sing down here with your diaphragm. And I'm like, everybody keeps saying that. What does that mean? Sing with your, I don't know how to sing with my diaphragm. And so what I did was, she said, lay flat on the ground, lay on your back, and putting yourself in that position, now you're only able to sing with your diaphragm when you lay flat. And it made sense. The big buzzwords right now in our field, in the business field, Apple, Google, is innovative. Everybody wants to be innovative and creative. And we throw those words around. Yeah, we're the most innovative. We're the most creative. But do we really know what that means? How do we develop these critical thinking skills? And just like how do we sing from our diaphragm, we got to position ourselves a little different. We got to kind of step outside and think outside of thinking outside the box. Everybody, yeah, I think outside the box. We hear that word, that phrase all the time. So how do we develop these critical thinking skills? How do we put ourselves outside the lines just a little bit? And I'm not saying that we need to be chaotic, and I'm not wearing my uniform today because I don't want to be like anybody else here. Or I'm not going to do 12 leads because, I want to be a little bit different. I'm not starting any IV. No, this has got to be a change for the better, not a change to being more lazy. So have you guys ever heard of a false dichotomy? What is a false dichotomy? A false dichotomy is a false dilemma. MasterCards, what's they're saying? There's a lot of things that money can't buy. For everything else, there's MasterCard. You guys know their catchy little slogan they had? That's an example of a false dichotomy. That's an example of saying, if it's not this, it's that. If it's not that, it's this. Pay attention. Now that you know this, you're going to see a lot of stuff in medicine. Well, if I can't do this, I have to do this. Well, if I can't do that, I have to do this. We got to get away from that false dichotomy thinking. We have to start thinking, what if? What if there's another option? I'm going to give you a really good example of this. So we were doing a critical care call from one of the local hospitals, and we were taking this person down to Milwaukee. And they had a trach, they were intubated, they were on the vent. And we walk in there, we hook up our vent circuit, test our circuit out, put it on, set up the vent settings. Circuit failure. It's a circuit failure. So we're like, okay, you know what? Sometimes we get a weird circuit, so we go through, we kind of do the troubleshooting, tighten up the spit cup, look at the diaphragm, go through all about it, hook it up again, circuit failure. So the nurses there are going, listen, either something's wrong with your vent or something's wrong with your circuit. So there's a little bit of a false dichotomy right there. Obviously, it's nothing we did. It's got to be you, right? And so I'm like, man, I don't understand this. We got the circuit is testing. It's passing fine. I'm hooking it to the test lung, and it's working. Every time I hook it up to this patient, it's a circuit failure. So I said, you know what? Sure, it could be the vent. It could be the circuit. But is his trach cuff inflated? And she's like, yes, it's inflated. And so I start doing this kind of troubleshooting where we take everything we know for sure and we set that aside. And anything that we don't know for sure or somebody's telling us, we need to investigate that a little further, right? So I had this idea. I go, you know what I'm going to do? And I said to one of our critical care medics, Matt Socks, I go, Matt, put an end title on her nose. And he's like, all right, because I'm thinking if that's not inflated fully, you're going to get end tidal coming up. And I could see her nose hairs moving. So I knew it wasn't, but I had to have a way of proving it, right? So we put the end tidal on her, and all of a sudden we see the waveform. I'm like, I go, are you sure that cuff is fully inflated? And she's like, well, I think it has a small leak in it. So you guys know how ventilators work. You got to have a complete circuit, right? If you don't have a complete circuit, it's going to say it's failing. So this false dichotomy of it's either this or it's that, sometimes stepping outside a little bit. Well, it ended up it was. So what did we do? We inflated the cuff until we saw the waveform disappear. It passed, and the call went on. But the biggest majority of our stuff that I think we get hung up on sometimes is troubleshooting. We took a video, and we asked our paramedics, we said, we want you to come in, we want you to swap this drip onto this pump. So something we often do at hospitals, right? We go take this off of this pump, put it on our pump, and we videoed them doing it. They had it switched in about a minute to 2 minutes. They didn't successfully start infusing for about 10 minutes. And I'm like, what's taking so long? Watching the videos back, it's the troubleshooting. They got it over, but once it says air alarm or, check this, fluid side occlusion, that's where they started going, I'm not really sure what's going on here. So we got to get away from that word or. It's either this or it's that. Now, Westbury Bank has this new kind of marketing thing they're going out with. It's called What If. What if a bank was fun? What if the lollipops didn't suck at the drive-thru? They don't have that one. But, what if this? What if that? And that what if is a lot better than or because it's got endless possibilities when you say that.